And while I was in the US, I was also diagnosed with chronic kidney disease, which means my kidney packed up.
Call me a prophet of doom, but many Nigerian celebrities go by within 5 years. Many. You will just hear them every year. You will just be hearing it. A number of them are already facing this issue of kidney failure. Many of them, a number of them have gone secretly to do transplants. There's a kidney failure epidemic, in case you don't know. And I respect this legend. That guy you just saw is the legendary DJ Jimmy Jatt. He went through it and he came through. He did a kidney transplant in Nigeria. In case you don't know, it's possible in Nigeria. He was in the US when he was diagnosed. He did dialysis there. According to him, he now came back to Nigeria and did a successful kidney transplant. I'm going to use this video to educate people so that you don't fall into the same issue. So for him to come to the public and say it, he's trying to sensitize people, but people don't understand. He's trying to sensitize younger ones that are coming up and people with healthy kidneys not to fall into the same thing, but he's just codedly passing the message. That's legendary. You know, that for somebody to come out and talk about their predicament. Let me tell you, in his own case first, let's start with his own case. My name is Dave Partner. If you're not following me, just click on my name to go and follow me, all right? Go to my profile and follow me, right? I'm not a medical doctor, so anything I'm saying, verify it with your doctor. Najeeb that be. So here's the thing, right? He said his own was caused by diabetes and hypertension. The diabetes, according to him, is genetic, right? And the hypertension now caused the kidney failure. Now, this is how most people understand it. But many people don't know that it also happens in the reverse. When your kidney is weak, your blood pressure will go up because your kidney can no longer filter fluid. Because of the fluid built up, your blood pressure will go up. So some people will be treating blood pressure and they will not know that their kidney is packing up. Go and check it. If you have blood pressure right now, right, what I want you to do is to go and discuss with your doctor whether you should do a kidney test. If you're in a country where it is allowed to go to the lab straight, go to the lab and do a kidney function test. Most of the time, you see that your kidney is already having damage, either from the blood pressure issue or your kidney is having damage. That's why you're having blood pressure. Many people will just be treating blood pressure without knowing. One day, you just hear sudden news, boom, your kidney don't pack up. And the thing with the human kidney is that it's so powerful. It can function at 90% failure rate. Your kidney can fail 90%. You will not feel anything. 90% of your kidney don't pack up. That remaining 10% is still using it to function. Even the dialysis machine manages to give you just 10% kidney function. So go and watch it so that you will not be surprised one day. Your kidney don't pack up. All of a sudden, you need millions. You know how much kidney transplant costs? And you have to be on a queue. You have to be waiting till they find a matching kidney. Some people think that when they do a transplant, they remove your dead kidney. No, they can't even risk that. So what they do is they attach the extra new kidney to your own kidney. So now you have 3 kidneys inside your body. Your life can never be the same. And the thing is that you have to be on lifetime medication so that your body will not attack the new kidney because it's a foreign body. If your body attack it, you don't pack up. There are celebrities that died like that. I don't even want to mention their name. A musician in Nigeria, he did a kidney transplant. His body rejected the kidney. Not die. Or you start hustling another second one. So, number one thing, watch. If you're having high blood pressure, watch your kidney. Both of them are connected. I'm telling you the truth. I'm telling you the truth. Okay? So, secondly, he said he has never smoked in his life. So where did the kidney problem come from? He said even drinking, that he just normal social drinking. I'm coming to that, right? But I want you to go and check, right? First of all, this is evidence of what I said. Yes, kidney damage can cause high blood pressure. Go and read it. Look at this. Some drugs can cause kidney damage. I'm not making it up. Go and research. Antibiotics, some of these, when you abuse it, that's why they tell you you can't just go and pick any antibiotics and start taking. Your doctor must recommend it. In fact, in some countries, you can't even see any antibiotics at the pharmacy unless you have doctor's recommendation. It's not that you have headache, you rush and go and take antibiotics. Blood pressure medicine. Remember what he said? He said he has blood pressure. Some of the medicines, their side effect over a long period is what? Kidney damage. They even write it. So take the drug you're taking, right? The blood pressure medication you're taking, bring out the leaflet inside it and read it through. Some people know they read. Some people know they read. Pick it, read everything. There's a section they normally label contraindications and stuff. Read everything. You will see side effects. If you are feeling any of the side effects, go and discuss with your doctor and say that medication they recommended for you, this is what is causing you. The side effect doesn't happen to everybody. You understand? And the doctor may give you a better one for you. Not all, but everybody's body is not the same. So all medicines don't work the same in all our bodies. Some people experience prick weakness from medications they are trying to use to treat something else like this. The prick no go the weak. Then they'll be adding more drugs like drinking all these agbo aphrodisiac drugs, and instead of actually opening the leaflet in the medicine and reading it to see what is causing, you will see it's written there prick weakness. So if you discuss with your doctor, they might change it. See, this treatment, these are NSAIDs. Are you seeing this drug? Ibuprofen. Ibuprofen can damage your. No, they take drugs anyhow. Make sure it's recommended by a trained professional, a pharmacist, a doctor that knows your medical history. You understand? No, just go, farmer, just give me ibuprofen. You just put two because you get waist pain. Just put two for my. see graveyard. Look at this one. Look at this one. See, can you see it? I don't know if you can see it. Antiviral medications. I don't want to call some of their names. So that's why I'm telling you right now, I'm cutting soap for you. If you have any medication that you are taking daily or weekly because of a certain sickness or the other, they just put you on medication. Take the packet, read what is inside, the side effects. Check whether you're experiencing some. If you're experiencing any, return back to your doctor and they will give you a better one. We as herbalists, now herbs will use street. Now look, kidney damage can be caused by a number of things, okay? Disease, can you see? Diabetes, you see? High blood pressure, kidney disease, and lupus, and so on. So if you have any of these, your eye should be on your kidney. Every year, at least every 6 months, you go and do a kidney test. They don't need to tell you. You don't need to be there. Go to lab and do a good lab. Let them do your kidney test. It's simple and it's cheap. To avoid what? Surprises. The worst, let me tell you, third world countries work until you have an emergency. If you're living in a third world country, everything seems okay until you have like health emergency, or there's fire burning in your house, or there's robbery, you need police to show up. That's when they work. I'm so happy that this kidney transplant is possible in Nigeria, which means it's way cheaper in Nigeria. I'm telling you, if you try kidney transplant abroad, you know that true human life is worthless. No, it's like how do you say? Human life is priceless. So now let's look at this. Excessive alcohol consumption can damage the kidneys. Alcohol can cause dehydration, high blood pressure, liver disease. Let me tell you, almost all diseases that people face, alcohol and smoking can cause it. I'm telling you the truth. Now, here's the thing, right? There was an event we wanted to do one time, so we bought like 30 different wine brands. We went to a well-known wine seller that has different branches across town. We ordered 30 different wine brands. You know that when we tasted all 30, so we tested the 30 drinks. All of them taste exactly the same. It's like somebody used one container to mix the liquid and poured it into the different brands and slapped the design of the different brands. We spent more than almost 2.5 million on different brands. All of them taste the same. The only one that tasted different was Amarula, because we know that they mixed it something like milk or something. Amarula was the cheapest there, like 5K or 10K then. But that was what convinced me that what these people are drinking in nightclubs is deadly poison. They are not those foreign drinks. They are not imported. They are clones of those foreign ones. Many of them will go down if care is not taken. If you are going to club to drink, look at your